Did you know that by the time you finish watching this video, another senior will be diagnosed with dementia? In fact, every 66 seconds, someone is told they're losing their memory. But here's the part that should stop you in your tracks. What if it's not just aging? What if the real cause is sitting right now, inside your medicine cabinet? Because most people believe something very simple. If a doctor prescribed it, it must be safe. And that assumption is where the real danger begins. Millions of seniors take medications every single day. For sleep, for allergies, for anxiety, for blood pressure, for digestion. They follow instructions. They trust the system. And yet, something doesn't feel right. Memory slips start happening. Names become harder to recall. Simple conversations feel confusing. At first, it's subtle. You forget where you placed your keys. You walk into a room and forget why. You lose track of what you were about to say. Then slowly, it becomes something more serious. Brain fog, mental fatigue, difficulty focusing, a growing sense that something is off. And the most terrifying part? Everyone tells you the same thing. It's just aging. But what if that's not true? What if your brain isn't simply declining, but being chemically suppressed? Because emerging research is revealing something deeply concerning. Certain medications, even common ones, may be interfering with the very chemicals your brain depends on to function. They can disrupt memory formation, reduce mental clarity, and over time, accelerate cognitive decline. Some studies have shown that certain drug classes are associated with up to a 49% increased risk of dementia within just a few years of regular use. Let that sink in. Not decades, not lifetime exposure, just a few years. And here's what makes this even more alarming. Many of these medications are not rare. They're found in everyday products, over-the-counter sleep aids, allergy pills, digestive medications, things people take without a second thought, things you may be taking right now. And no one warns you. No one tells you that these drugs may be affecting your brain, because the changes don't happen overnight. They happen slowly, quietly, silently, until one day you begin to notice the difference. And by then, it may feel like it's too late. But here's the truth most people never hear. In many cases, this kind of cognitive decline is not permanent. If the root cause is identified early and the right changes are made, your brain has the ability to recover, which means this isn't just a warning. It's an opportunity, because in this video, we're going to break down the most common medications that may be silently affecting your memory. And more importantly, what you can do to protect your brain before it's too late. So before you assume it's just aging, ask yourself one question. What if your memory loss isn't inevitable? To understand what's really happening, we need to look at one of the most important chemicals in your brain, acetylcholine. This isn't just another neurotransmitter. Acetylcholine is the signal that allows your brain to function clearly. It helps you form new memories, stay focused, process information, maintain mental clarity. Every time you remember a name, follow a conversation, or learn something new, acetylcholine is involved. Think of it as the communication system of your brain. It allows nerve cells to talk to each other, to pass signals, to stay connected. But here's the problem. As you age, your brain naturally produces less acetylcholine, which means your system becomes more fragile, more dependent on every signal working properly. And this is where certain medications become dangerous, because many commonly used drugs, especially those prescribed to seniors, work by blocking acetylcholine activity. These are called anticholinergic effects. And while they may help with certain symptoms, like sleep, allergies, bladder control, or anxiety, they come with a hidden cost. They reduce communication inside your brain. Signals become weaker, slower, less efficient. At first, the effects may feel small: slight forgetfulness, difficulty concentrating, mild confusion. But over time, as this interference continues, the impact becomes more serious. Memory formation is disrupted, focus declines, mental clarity fades, and your brain begins to operate in a low-signal state. Imagine trying to have a conversation. With a poor phone connection, words cut out, signals drop, nothing feels clear. That's what's happening inside your brain. And when multiple medications are involved, the effect compounds. Each one blocks a little more. Each one reduces signal strength further, until your brain is no longer functioning at full capacity. This is why understanding acetylcholine is so important, because it explains something most people miss. The issue is not just the disease. It's the disruption of communication. And once that communication breaks down, everything else follows. Memory, focus, awareness. So before we look at the specific medications, you need to understand this foundation. Because once you see how these drugs affect your brain, everything that follows will make sense. Let's start with a medication that almost everyone recognizes, diphenhydramine. You may know it as Benadryl. It's commonly used for allergies, cold symptoms, and even as a sleep aid. It's cheap, easy to find, available over the counter. And because of that, most people assume it's completely safe. But inside your brain, a very different process is happening. Diphenhydramine belongs to a class of drugs called anticholinergics, which means it blocks acetylcholine, the very chemical your brain depends on for memory and focus. And one of the most vulnerable areas affected by this is the hippocampus. This is the part of your brain responsible for forming new memories, storing information, learning new things. When diphenhydramine interferes with this region, memory formation becomes weaker. New information doesn't stick as easily. And over time, this effect can become more noticeable. You may start to experience forgetfulness, confusion, slower thinking, especially if the medication is used regularly. Now, here's where it becomes more concerning. As your brain ages, it becomes more dependent on acetylcholine, which means blocking it has a stronger impact. And studies have shown that seniors who use anticholinergic medications regularly may face a significantly higher risk of developing dementia. In some research, this risk increases by more than 50%. From something as common as a sleep aid, and the most dangerous part, many people take it every night, without realizing that it may be affecting their brain over time. Because the effects are gradual, subtle at first, but cumulative. So while diphenhydramine may help you fall asleep, it may also be quietly disrupting your brain's ability to function properly. And that's something most people are never told. Next on the list is a medication many people take every single day, often for years, without ever questioning it. Proton pump inhibitors, or PPIs. These include drugs like omeprazole, esomeprazole, pantoprazole. They're commonly prescribed for acid reflux, heartburn, GERD, and at first, they seem incredibly helpful. They reduce stomach acid, relieve discomfort, make eating easier. But here's what's rarely explained. Your stomach acid isn't just there for digestion. It plays a critical role in nutrient absorption, especially for one essential vitamin, vitamin B12. B12 is vital for your brain. It supports nerve function, memory, mental clarity, mood stability, but without enough stomach acid, your body struggles to absorb it. And when PPIs suppress acid production for long periods, B12 levels can begin to drop, slowly, silently. And this is where the problem begins. Because B12 deficiency doesn't just affect energy, it directly impacts your neurons. Your nerve cells rely on B12 to maintain their structure and function. Without it, signals become weaker, communication slows down, and symptoms start to appear. Brain fog, forgetfulness, difficulty concentrating, mental fatigue. At first, it may seem minor, but over time, it can begin to resemble early cognitive decline. Now add another layer. PPIs don't just affect B12. They also interfere with the absorption of magnesium, calcium, both of which are essential for proper nerve signaling. So now, your brain is dealing with multiple deficiencies at once. Less support, weaker signals, higher stress. And studies have shown that long-term PPI use, especially in older adults, is associated with a significantly increased risk of dementia. Not because the drug directly damages the brain, but because it slowly deprives the brain of what it needs to function. And the most concerning part? Many people stay on these medications for years, sometimes decades, without ever reassessing the need. So while PPIs may relieve your stomach, they may also be quietly affecting your brain. And that's a trade-off most people never realize they're making. Next is a medication that many seniors are prescribed, often without being warned about its effects on the brain. Oxybutynin. This drug is commonly used to treat overactive bladder, urinary urgency, incontinence. On the surface, it seems helpful. It reduces sudden urges, prevents accidents, improves daily comfort. But here's what most people don't realize. Oxybutynin has a very strong anticholinergic effect, which means it blocks acetylcholine, the same critical brain chemical we talked about earlier. And unlike some milder medications, oxybutynin crosses directly into the brain, easily. Once inside, it doesn't just affect the body, it directly impacts memory centers, especially the hippocampus. This is where new memories are formed. So when this area is disrupted, the effects can be immediate. You may begin to notice increased forgetfulness, difficulty focusing, trouble recalling recent events, mental fog. Some people describe it as feeling like their brain is slower or not as sharp as before. And the most concerning part, these symptoms are often mistaken for normal aging. But in many cases, they are actually medication-induced. Studies have shown that long-term use of strong anticholinergic drugs like oxybutynin is associated with a significantly higher risk of dementia. In some cases, the risk increases by nearly 50% after extended use. And because this medication is often taken daily, the effects can build over time, slowly, quietly, until the changes become difficult to ignore. So if you or someone you know is taking oxybutynin and has noticed changes in memory or focus, it's important not to dismiss it, because it may not be just aging. It may be a direct effect of the medication itself, and recognizing that difference can make all the difference. Now let's talk about one of the most widely prescribed medications in the world, statins. These drugs are commonly used to lower cholesterol, reduce the risk of heart attack, prevent stroke. For many people, they are considered essential. But here's something most people are never told. Cholesterol is not just a bad substance. In fact, your brain depends on it. Nearly 60% of your brain is made up of fat, and cholesterol plays a critical role in maintaining its structure. One of its most important functions is supporting the myelin sheath. This is the protective layer that surrounds your nerve cells. It allows signals to travel quickly and efficiently through your brain. Without healthy myelin, communication slows down, signals weaken, and brain function becomes less efficient. Now, here's where the concern begins. Statins work by aggressively lowering cholesterol levels, which is helpful for your heart, but may have unintended effects on your brain. Because when cholesterol drops too low, your brain may not have what it needs to maintain optimal function. Some people report symptoms like memory lapses, brain fog, difficulty concentrating, slower thinking. And while not everyone experiences these effects, research has raised important questions. Some studies suggest that long-term statin use, especially in older adults, may be associated with an increased risk of mild cognitive impairment, particularly with higher doses. Now, to be clear, this is still a debated topic. Not all statins affect the brain in the same way. Some types cross into the brain more easily, while others remain mostly in the bloodstream, which means the risk can vary depending on the specific medication. But the key point is this: your brain needs balance. Too much cholesterol can be harmful, but too little may also create problems. So if you've been taking statins for years and you've noticed changes in your memory or mental clarity, it may be worth discussing with your doctor. Because sometimes the goal isn't just lowering numbers, it's maintaining function. And protecting your brain is just as important as protecting your heart. Next is a group of medications that many people rely on, especially during times of stress, anxiety, or sleep problems. Benzodiazepines. These include drugs like Xanax, Valium, Ativan. At first, they can feel like a relief. They calm your mind, reduce anxiety, help you fall asleep faster. For many seniors, they seem like a solution, but over time, they can become something else entirely. Because benzodiazepines don't just relax your brain, they slow it down. They work by enhancing a chemical called GABA, which reduces brain activity. This creates a calming effect, but when used regularly, it can lead to a state of chronic mental slowing. your brain becomes less active, less responsive, less adaptable, and this is where the problem begins. You may start to notice memory gaps, slower thinking, difficulty concentrating, feeling foggy or disconnected. Some people describe it as not feeling like themselves anymore. And over time, the brain becomes dependent on the drug. This is what makes benzodiazepines particularly dangerous. They can be habit-forming, your body adapts, and stopping becomes difficult. Because without the medication, symptoms like anxiety and insomnia often return, sometimes even stronger than before. This creates a cycle. Take the drug, feel relief, become dependent, need more support. Meanwhile, your brain continues to slow down, and research has shown something even more concerning. Long-term use of benzodiazepines, especially in older adults, is associated with an increased risk of Alzheimer's disease. In some studies, this risk increases by more than 50% after extended use, not because of one single dose, but because of cumulative exposure over time. The brain remains in a suppressed state for too long. Learning slows, memory weakens, cognitive flexibility declines, and gradually, the brain loses its ability to function at full capacity. So while benzodiazepines may offer short-term relief, they can come with long-term consequences. And the most important thing to understand is this: the effect is not always obvious at first. It builds slowly, until one day, you begin to notice the difference. And by then, it may feel difficult to reverse. That's why awareness is critical, because recognizing the pattern early can make all the difference. Next is a medication that has been around for decades and is still commonly prescribed today. Amitriptyline, originally developed as an antidepressant. It's now often used for chronic pain, insomnia, nerve-related conditions. On the surface, it seems like a versatile solution. One pill, multiple benefits, but beneath that convenience, there's a serious concern. Amitriptyline is one of the most powerful anticholinergic medications still in use, which means it strongly blocks acetylcholine, the same critical brain chemical responsible for memory, focus, and learning. And unlike milder drugs, its effect is not subtle. It creates a significant reduction in brain signaling, especially when used long-term. At first, you may notice slight forgetfulness, slower thinking, difficulty concentrating. But over time, these effects can become much more pronounced because the brain isn't just being slowed temporarily. It's being consistently suppressed. And research has shown just how serious this can be. In a large long-term study, people who used strong anticholinergic medications like amitriptyline had up to a 54% higher risk of developing dementia. That's not a small increase. That's a major shift in risk. And what makes this even more concerning is how often this medication is prescribed. Many seniors take it nightly, for sleep or pain relief, without ever being warned about its cognitive effects. Because the decline doesn't happen suddenly, it happens gradually. Next is a medication that many people believe is modern, safe, and widely trusted: paroxetine. It belongs to a group of drugs called SSRIs, selective serotonin reuptake inhibitors. These are commonly prescribed for depression, anxiety, mood disorders, and in many cases, SSRIs are considered safer than older antidepressants. But here's what makes paroxetine different. It's the only SSRI with strong anticholinergic effects, which means, unlike most drugs in its class, it still blocks acetylcholine, the same chemical your brain depends on for memory and clarity. This one detail changes everything. Because while other SSRIs, like sertraline or escitalopram, have minimal impact on cognition, paroxetine directly interferes with brain signaling. And over time, this can begin to affect short-term memory, attention span, mental sharpness. Some people report increased forgetfulness, difficulty recalling words, trouble focusing on simple tasks. At first, these changes may seem mild, but with continued use, they can become more noticeable. And research has shown that seniors taking paroxetine are more likely to show early signs of cognitive decline compared to those using other antidepressants. That's what makes this medication especially concerning. Because it's often prescribed with the intention of improving mental health, yet over time, it may be affecting mental clarity. And the most important takeaway is this: not all medications within the same category are equal. Just because a drug is labeled as an SSRI doesn't mean it carries the same risk profile. So if you or someone you know is taking paroxetine and noticing changes in memory or focus, it may be worth discussing alternatives. Because in many cases, there are options that support mood without compromising cognitive function, and understanding that difference can help protect your brain in the long run. Next is one of the most concerning categories on this list: antipsychotic medications. These drugs were originally developed to treat severe psychiatric conditions, such as schizophrenia, bipolar disorder. But today, they are often used for something very different. Many seniors are prescribed antipsychotics for sleep problems, agitation, confusion, behavioral symptoms, even in cases where the issue is mild. And this is where the danger begins. Because these are powerful brain-altering drugs, not designed for routine use in older adults, yet they are frequently used simply to manage symptoms, sometimes for convenience, rather than necessity. Now, let's look at what these drugs actually do. Antipsychotics work by blocking dopamine, a critical brain chemical. Dopamine is essential for motivation, focus, emotional balance, memory processing. When dopamine levels are reduced, the brain slows down, signals weaken, responsiveness decreases. This is why many seniors on these medications appear less alert, emotionally flat, mentally withdrawn. Some even describe it as feeling numb or disconnected. And over time, this effect becomes more serious because prolonged suppression of brain activity leads to cognitive decline. Research has shown that seniors taking antipsychotics, especially for non-critical reasons, have a significantly higher risk of worsening dementia. In some studies, the risk of cognitive decline increased by over 70% within just 1 year. That is not a gradual change. That is rapid decline, and the consequences go beyond memory. These medications are also associated with increased risk of stroke, higher risk of falls, cardiovascular complications, which makes them especially dangerous for older adults. And perhaps the most concerning part, many families are never fully informed. They see changes in behavior, confusion, withdrawal, memory loss, and assume it's the disease progressing, when in reality, it may be the medication itself. So if you or a loved one is taking an antipsychotic, it's important to ask, is this truly necessary? Or is it simply being used to manage symptoms, without addressing the cause? Because in many cases, non-drug approaches, like improving environment, routine, and sleep, can be just as effective without putting the brain at risk. And understanding that difference can help protect not just memory, but quality of life. Now we come to the most dangerous factor of all. Not a single drug, but a combination, polypharmacy. This is when someone takes multiple medications at the same time, especially drugs that share similar effects on the brain. And this is where the real risk multiplies. Because each medication may seem harmless on its own, a sleep aid, an allergy pill, a bladder medication, a pain reliever. Individually, the effects might feel small, barely noticeable. But when combined, they don't just add up, they compound. Each drug blocks a little more acetylcholine. Each one reduces brain signaling further, until your brain is operating in a weakened state. This is what researchers call anticholinergic burden. And the higher that burden, the greater the risk. In fact, large-scale studies have shown that seniors with the highest anticholinergic load have up to a 120% increased risk of developing dementia. That's more than double the normal risk. And here's the most alarming part. Most people have no idea this is happening because no one is looking at the total picture. Each medication is prescribed separately. Different doctors, different conditions, but the brain experiences them all at once. Let's look at a real-world example. Imagine this. A senior takes diphenhydramine at night to sleep, oxybutynin during the day for bladder control, and amitriptyline for nerve pain. Each one affects acetylcholine, but together, they create a powerful cumulative effect. The brain becomes slower, memory weakens, focus fades, and over time, this can look exactly like dementia. But in many cases, it's not permanent damage. It's drug-induced decline, which means it can often be reversed. And this is where the opportunity lies. Because unlike many neurological conditions, polypharmacy is preventable and often correctable. The first step is awareness. The second step is action. If you or someone you know is taking multiple medications, it's important to request a full medication review, not just prescriptions, but over-the-counter drugs and supplements as well. Ask a doctor or pharmacist, which of these medications have anticholinergic effects? Which ones overlap? Which ones can be reduced, replaced, or removed? Because even small adjustments can make a significant difference. And as the burden is reduced, something powerful can happen. Mental clarity may improve. Energy may return. Memory may begin to stabilize. Because your brain is no longer being suppressed from multiple directions. And that's the key insight. Sometimes, the problem isn't what's happening to your brain. It's what's being done to it. And once that changes, recovery becomes possible. That's why polypharmacy is not just the #1 risk. It's also the #1 opportunity. When you step back and look at everything, a very different picture begins to emerge. This isn't just about aging. It's not just about genetics. And it's not simply bad luck. In many cases, cognitive decline is influenced by something far more controllable. Your medications, from common sleep aids to stomach medications to anxiety drugs, many of these can affect how your brain functions, especially when used long-term or in combination. And the most important thing to understand is this. Some of this damage may not be permanent. In fact, when the root cause is identified early and the right changes are made, the brain can begin to recover. Mental clarity can improve. Memory can stabilize. Energy can return. Because your brain is no longer being suppressed, it's being supported, and that changes everything. So instead of assuming decline is inevitable, ask a better question. Is something I'm taking affecting my brain? Because awareness is the first step, and action is the second. Review your medications. Talk to your doctor. Look at the bigger picture, because sometimes the solution isn't adding more. It's removing what's causing harm. If this video helped you see things differently, take a moment to share your experience. Have you noticed brain fog, forgetfulness, or changes in focus? Leave a comment below. Your story might help someone else recognize the same pattern. And if you found this information valuable, share it with someone you care about, because the earlier this is understood, the more powerful the impact can be. Your brain is not meant to decline this way, and in many cases, it doesn't have to.